Emphysema. Emphysema is any air-filled enlargement in the body tissues. Most commonly, emphysema refers to the permanent enlargement of air space in the lungs and is also known as pulmonary emphysema. Emphysema is a lower respiratory tract disease characterized by enlarged air-filled space in the lungs that can vary in size and may be very large. The spaces are caused by the breakdown of the wall of the alveoli, which replaced the spongy lung tissue. This reduced the total alveolar surface available for gas exchange, leading to a reduction in oxygen supply from the blood. Emphysema usually affect the middle-aged or older population because it takes time to develop within the effect of tobacco smoking and other risk factors. Alpha 1 antitrypsin deficiency is a genetic risk factor that may lead to the condition presenting earlier. When associated with a significant airflow limitation, emphysema is a major subtype of chronic obstructive pulmonary disease, a progressive lung disease characterized by long-term breathing problem and poor airflow. Without COPD, the findings of emphysema on a CT lungs can still confer a higher mortality risk in tobacco smokers. There are four types of emphysema, three of which are related to anatomy of the lobule of the lung. That means central lobular or centriacnular, panlobular, and paraseptal, or and are not associated with fibrosis. The fourth type is known as irregular emphysema that involve the acnes irregularly and is associated with fibrosis. Signs and symptoms of emphysema. Emphysema is a respiratory disease of the lower respiratory tract, commonly caused by tobacco smoking, but a significant number of people affected who either do not smoke or have never smoked. The presence of emphysema is a clear risk factor for the development of lung cancer, made stronger in those who smoke. Early symptoms of emphysema may vary from person to person. Symptoms can include cough with or without sputum, wheezing, fast breathing rate, breathlessness on exertion, and feeling of tightness in the chest. There may be frequent cold or flu infection. Other symptoms may include anxiety, depression, fatigue, sleep problems, and weight loss. These symptoms could also relate to other lung conditions or other health problems. Therefore, emphysema is often undiagnosed. Diagnostic tests of emphysema are history collection, physical examination, ABG analysis, pulmonary function test. What is the first line treatment for emphysema? Bronchodilators. Bronchodilators are the backbone of any airway disease. They work by dilating airway and thereby decreasing airflow resistance. This increases airflow and decreases dynamic hyperinflation. What are the best antibiotics for emphysema? Doxycycline, azithromycin, amoxicillin clavinated. Treatment of emphysema include quit smoking, using steroid inhalers, exercise regularly, diet and nutrition, preventing respiratory infection, use of antibiotics if there is infection. Nursing management of emphysema assessment include frequent assess the patient lung sound and respiration, assess oxygen saturation, encourage expectoration of secretion, provide supplemental oxygen, instruct on breathing techniques, prepare for surgery. Surgical management of emphysema. Lung volume reduction surgery is a surgery to help people with severe emphysema affecting the affected upper lobes. Lung volume reduction surgery is not a cure for COPD but may improve your exercise capacity and quality of life. What is a bullectomy surgery? Bullectomy is surgery to remove air pockets in the lungs. This procedure can help the lung to work better. Bullous emphysema. Bullous emphysema is characterized by damaged alveoli that distend to form exceptionally large airspace, especially within the uppermost portion of the lungs. This condition sometimes occur otherwise healthy young adult. What is the surgery for bullous emphysema? Types of surgery for bullous emphysema include bullectomy. Your surgeon remove the bullae from your lung using open surgery. That means thoracotomy. A minimally invasive procedure, video assisted thoracic surgeries. These COPD and alpha 1 antitrypsin deficiency emphysema remains one of the major indications for lung transplantation. Can your lungs repair from emphysema? There is no way to repair or regrow the damaged lung tissues. How successful is a lung transplant? Because of the fragility of the lung, the survival rate for lung transplant patients are not as good as for other solid organ transplant, with a 5-year survival rate of about 50 to 60%. The biggest limiting factor in lung transplant is having enough suitable lung donor. Can emphysema be prevented? Since smoking causes most cases of emphysema, the best way to prevent it is to not smoke. It is also important to try to avoid lung irritants such as a secondhand smoke, air pollution, chemical fumes, and other dust. A small percentage of cases are caused by familial or genetic disorder alpha 1 antitrypsin deficiency. While damaged airway do not regenerate and there is no cure, emphysema is preventable and treatable.